Developmental disability throughout a lifetime. Boxall's quote is that music therapy is opening new channels to the furthest reaches of personal development and humanness. Developmental delay is an umbrella term for many diagnoses. I'm mostly going to talk about intellectual disabilities and autism. Intellectual disabilities have levels of severity: mild, moderate, severe, profound. Autism used to be diagnosed through saying you have autism, Asperger's, Rett syndrome, or pervasive developmental disorders. Now, with the new DSM, number 5, they're all under one term. Intellectual disability. It's not a medical diagnosis and it's not a mental illness. Persons with intellectual disability have significant deficits in communication, abstract reasoning, social behavior, and motor development. It's important to note that with proper supports, individuals with intellectual disabilities can almost always improve their quality of life. Autism is a neurological disorder. You might see it in the autism aloneness, the way that they show emotion, auditory, visual responses, their attachment to people, things, and repetitive behaviors. Autism affects individuals in differing ways, and you'll see more about that. It is important to note that with proper educational and social interventions, an individual with autism may develop the functional and appropriate skills that they need in their areas. So, mental retardation, intellectual disability, can be linked to biomedical factors, genetic or chromosomal exposure in the womb to alcohol, drugs, the low birth weight, prematurity. Social factors is that they might get limited stimulation or they might be neglected as a child. There are also behavioral and educational factors. There is no clear cause for autism. There's an indication that there are differences in a neurotypical brain and a brain of in someone with autism. Also, current research suggests that there may be a genetic origin, and it would be a combination of about 10 genes. Intellectual disability can be seen at 9 months. The child may show difficulty in gross motor functions or the way that they respond to a caregiver. At age 3, they have lack of imitation skills, trouble following directions, or avoidance of eye contact. For autism, that's usually noticeable about a year and a half, but they're usually diagnosed 2 to 3 years old. An individual with the characteristics of Asperger's, it takes them longer to diagnose that. Intellectual disability have average intellectual functioning. Like I said, it's below 70. They must also have behavioral limitations, receptive expressive language, reading, writing, money concepts, self-direction, social skills, and practical skills. The qualities of autism: they have qualitative impairments in communication and social skills, expressive receptive language, limited range of interests and activities is something that you'll see, and then also they exhibit self-simulating behaviors. There's a little bit more about communication. They repeat words, that's a echolalia. They may have they have difficulty interacting with peers, or they might have minimal direct eye contact. As far as the language goes, their response to verbal cues or directions may be lessened, or they might have unusual responses. They have a limited range of interests, so they might be really good at math or really good at music. This is not in all individuals with autism, but they do have that in some cases. They have ritualist behaviors, sameness of routine, their resistance to change, also odd, unusual play, and attachment, like I said before, to objects, other people. They have an oversensitivity or less sensitivity to the stimuli around them. They might perceive it as pain. And then there's also the self-calming, repeated body movements and stimming. So, if you know one person with autism, you know one person with autism. There's also more manifestations. They might show anxiety, inability to focus, subtle lilting around a room. That would be kind of like if they're walking on their tiptoes instead of heel toe. And then the rest, they have trouble with flexibility, but the rest is kind of congruent to what we've seen before. What's the areas of need for both of these? Cognitive skills, adaptive skills, academic, communication and social, self-direction, leisure skills, physical, motor, and behavior. Behavior, some of the reasons for that might be they might be self-stemming, they might be obsessive compulsive, attention sinking. They want your attention. They want to escape something or avoid something, or they might be trying to get that music or that toy. The big thing is that behavior is linked to communication. They're trying to communicate. So, when a child or a client with autism learns ways to interact appropriately and communicate their wants and needs, there should be success in interactions with others, and bad behavior should decrease. So there's many factors in therapy. One thing that you need to keep in mind is that you need to be knowledgeable about the neurotypical development of children and adults. Behaviors have many contexts: biological, psychological, social. Biological and the perception, motor disorders, sensory disorders, language pathways, somatic handicaps, psychological and sensory deprivation, adaptational patterns, conflict, anxiety, self-concept, and in the social cultural. They have to be in the IDA. They have to be tested socioculturally based on what happens different in their family group or their cultural group. The goal is awareness through communication, and all changes must be happening intrinsically. The proprioceptive, tactile, visual, and auditory parts of the brain work together to have responses. Here's ideas in music therapy. With modeling and facilitation, a client can access imaging and sound organization skills. So what you do as a music therapist is you reflect, match, support, change, or redirect behaviors. This brings about congruence and synchronicity within a person. And then you have composed music. It can specifically help with problem behaviors or locomotion of the moving parts. You can convey moods through a familiar song or the context of this song, ideas, objects, people. Adaptive music, it's where you make changes to the music that you are performing based on the functional levels and the needs of the client. You're making adaptations. It builds creative expression and it utilizes musical dramatization. We have group music therapy and individual music therapy. They have some things that compare. They try to build self-esteem through successes. They refine or improve auditory processing or memory, speech and language skills, expressive language, and receptive language, fine and gross motor skills or specific tasks, and they deal with academic concepts. Group music therapy has more attention to tasks, social skills, self-expression, leisure activities. And individual music therapy deals with improving visual perception and reinforcing basic concepts. So, how do you use music? Music movement, singing, chanting, instrumental playing. How do you individualize therapy? You might change the participation, how much direction you're giving or how much you're expecting out of them, the levels of difficulty. You might give them more time to do things. You might change the instruments or the space around them. You might support them more and use visuals. There's a suggested order of events from Wigram. It has an opening and a closure on the bookends, and then there's improvisational free and structured play, and then they introduce new material. That might be where you work on social skills or motor skills, and then you discuss what you've learned, and then you kind of support their exploration of it. The body cannot be talked out of a poorly behaving psychologic system that is causing psycho-emotional problems, but music has elements that the body understands, and through music, messages can be given to the body. So, reflection is when they're screaming, you're screaming, but you make it in a musical context. They're tapping, you tap, but you do it in a musical context. Identification is where you say, Jordan is screaming, I am screaming, and you put a name to the person and what they're doing at that moment. Our context song happens on the initiation of the client. It's what they prefer, what they choose, and it provides a connection upon which a music therapist can build a therapeutic rapport. Music. It has pulse, pattern, repetition, and tempo. Melody has melodic contours, and when you think about laughter or sobbing, there's exhalation and inhalation. It affects emotions. If you have music that has more exhalation, ups, it's like laughter. The harmony adds depth and texture, color. Then the timbre is the texture of individual sounds, like a soprano and a bass. They have inherently definitive differences in their sound. Dynamics is the softness or loudness. You might use it to improve motor functions. So as they're holding a stick and using dynamics, they're learning how to use their hand. Form, it has the peaks and valleys. You wait, you wait, you wait, you go. That kind of teaches turn taking or waiting skills. Early childhood. The goal of early intervention is to give very young children a head start and close the developmental gaps that may have arisen due to disability or an at-risk condition in their life. Special education services for early intervention are birth through 2, and it's a federal and state program. You might find intensity of engagement, individualization, family involvement, plans to specialized curriculums, objective measurements and progress, and opportunities to interact with non-disabled peers. It's important that you start at the earliest point for this intervention. Smith and Lovelace conducted research in 1993, that 40 hours of intense applied behavioral analysis, ABA therapy, assists in the recovery from autism. Don't like that phrase, recovery from autism, but it was 1993. You must use developmentally appropriate practice with early childhood. Goals must be achievable and challenging. They are based on child development. They reduce the achievement gap. They must be comprehensive and in an effective curriculum. So you have play skill development and musical development. Children learn about aspects of the world through play development. Structured, systematic play helps them have rigid play while still adding the spontaneous play that is learning. So we have different developmental stage ideas for play: functional, constructive, symbolic, games with rules, and then on the other side it's based on how you interact with others: unoccupied, solitary, onlooker, parallel, associative, and cooperative. Music development. Reflexive is when you react to changes in the music environment, move your body to music. That's birth to 9 months. Intentional is when you can find sound, you can recognize songs, and you can move your hand in, your hand out. That's 9 months to 18 months. And then control, they can use accurate pitches or their contours. They remember lyrics, and they have better motor control. Within schools, over 6 million students ages 3 through 21 in the year 2007 received special education services. That was 10% of students. There are 13 disability categories, and under the IDA, students are given the right to schooling with zero reject, non-discriminate evaluation, appropriate education, the least restrictive environment, and then the parents and the students have a say in what is happening in education. You might find inclusive music classroom or self-contained special education setting. Music facilitated interactions and structured and instrument playing are effective to improve social skills. So it's a long-term change, and then it positively affects social problem solving skills. When playing, making a transition into a classroom, greeting people in a known situation, music has assisted those with autism. So, when given the tools for communication, a student will have the power to meet their needs, manage behaviors, and interact meaningfully and socially with peers. Give them the communication and they can do it. So, paying bills, doing laundry, studying, even getting out of bed for class in the morning can be especially challenging for students with autism. However, they can thrive in the community if they have the right support. Think about the things you need to determine your future. You need to be able to tell people what you want, your preferences. You need to be able to set goals, make choices, manage your time, identify and solve problems. Oh, that's a problem, I need to fix it. But then also get the resources that you need to solve the problem. You need to be able to self-advocate. So things that will be addressed in the ITP, we had the IFP, IEP, and now the transition plan. School, post-school, work options, income, residential options, transportation, medical needs, community recreation and leisure options, maintenance of relationships, advocacy, and things that are specific to the individual. The American Disabilities Acts with Disabilities Acts, ADA, eliminates barriers that are physical and of discrimination and discriminatory for people with disabilities. So disabilities, mobility, communication, learning, social skills, emotional well-being, and employment. The entitlement and anti-discrimination laws work together to provide appropriate accommodations for individuals with disabilities. So, Thank you so much for watching my video, the birth to community life of individuals with developmental delay. This is Jordan Benton. Thank you. Goodbye.